Welcome to the last video in our series. Today we're going to be discussing what might be contributing to you developing chronic pain and how you might know that you have chronic pain. So what might contribute to you developing chronic pain? Well, there are literally hundreds and hundreds of factors that might cause someone to develop chronic pain, but there are some things that science tells us is more likely to predispose you to developing chronic pain. One of these is genetics. So if a family member has had a chronic pain condition, then you might be more prone to developing chronic pain. Stress. We all know that stress impacts our health, and the same is true for pain. Poor sleep often goes alongside stress, and poor lifestyle choices also often go alongside stress. So things like smoking, a bad diet, not exercising enough. All of these factors can contribute to a simple injury turning into something that becomes a lot more complicated and that gives you chronic pain. Something that lots of people don't know about is that often traumatic events that have happened in childhood or even in adulthood can contribute to developing chronic pain. And not moving causes joint stiffness, causes pain. And this can also contribute to pain becoming a much bigger problem than it needs to be. So how will you know if you have chronic pain? Well, the first thing is, has it been there for longer than 3 months? The second thing is it not responding to treatment the way you would want it to or the way you would expect it to? And the next thing is it having a significant impact on your life? Are you no longer able to do the things you want to and have to do? And then it's really about thinking a little bit about how you feel, what your pain feels like. Is it spreading? Is it moving around? Is putting cold on it making it worse? So an acute pain, we would expect an ice pack to help. In chronic pain, heat tends to make it better and cold makes it worse. Is it painful for someone to give you a hug or touch you? Do you have sensitivity to other things, bright lights, smells? Have you suddenly become more sensitive to noise? Do you no longer cope with being with lots of people? Do you find that you struggle with poor memory and poor attention and concentration? People with chronic pain often tell us that they feel like they're losing their minds because they can no longer focus, they can no longer pay attention to the things that are important to them. All of these things might indicate that your pain has changed and has become chronic, has become problematic, has become stuck. And you might need a team to help you unstick it and get to the answers. I hope you enjoyed this series. If you have any further questions, please feel free to visit our website at www.thepaincollective.com or give us a call. We'd be happy to answer any questions you might have.